much indeed, Mr Deputy Speaker. And this is a massively important debate on a subject that comes into our constituency and our surgeries every week. Yeah. Has done since the day I came into this House and when I was working for Sir Teddy Taylor all those years ago as well. This is not new. But what is new is a government attempting to address it. Yeah. I was sat on the opposition front bench for 4.5 years as a Shadow Health Minister, and previous governments have looked at this and tried at this, and actually at the end of the day, to be really honest, Conservative and Labour governments have kicked the can down the road. So for once we're trying. Is it perfect? No, it's not going to be perfect. And I'll come on to a couple of points that I agree with my colleagues on here in a moment. But what we can't do is keep borrowing. Markets are low. We can keep borrowing. We could go to that wonderful PFI market that previous Labour administrations went to, which we're still paying for now. Lord Darcy came up with a fantastic plan, actually, of how to deal with elective surgery in the market without having the overcapacity within the NHS. The only problem is they issued contracts that they were being paid, these companies were being paid, even though they weren't doing the operations. So nothing is perfect, and everybody wants to try, and it's very easy to be in opposition and throw the can across. That's what oppositions do. But actually, when the crunch comes, this is the decisions and these are the hard things. Now, I'm a Conservative, and I'm a fiscal Conservative. I'm a working class Tory, so I love all this class rubbish that keeps being thrown across the chain. Absolute, complete and utter tosh. At the end of the day, our constituents look to us for guidance and to try and solve their problems. That's what they look to us to do. They don't really care where we come from in life and what we are doing. At the end of the day, that's what they want us to do. No, I'm not going to give way because there are lots of other colleagues that have come in, and every time I give way, it's an extra minute, and I've just lost half a minute just by saying that. we can say to ourselves, is this perfect? No, it's not. Is this going to help? Yes, it is. Are there more people that are going to pay more taxation? Have we broke a manifesto commitment? Yes. And governments have done that for years in previous administrations, and that happens when the public expect us to act on something which has come literally out of the blue. So what's come out of the blue? COVID. We have had to borrow unbelievable amounts of money to keep people's jobs, incomes and livelihoods going. We can't keep doing that. And so we have to actually turn around and say, is there a way? And we heard from the chairman of the Select Committee, Treasury Select Committee earlier on, there are a myriad of different other ways. And there are minutiae around how national insurance can be done. At the end of the day, it seems to me that national insurance is probably the way to do it. It also seems to me, one criticism from me, which I agree with my honourable friend on. In my constituency, we've still got over 12,000 council properties. Many of those people want to buy their property on right to buy. They can't because the maximum discount means that the mortgage is still too large, too great. By having just over an £80,000 cap on this isn't fair nationally. It won't be that fair. You know, if you've got property, you know, that's below that income, that's really difficult. So in parts of the country where £86,000 will buy a property, in my constituency, that buys you a quarter of a one-bedroom flat. That has to be wrong. So we need to look at somehow how we address the issues that have been raised by colleagues earlier on. But the one thing I would ask, if anybody was watching this debate, and especially the early engagements, frankly, they would be disgusted at what they watched. Partisanship, chip on the shoulder, class wars, this war, that war. They don't give a monkeys about that. They want us to come here and do a job which is to help them and help their loved ones. And it's about time we got off our butts and did it.